All right. Today, in general anatomy and physiology, we're going through the respiratory anatomy. Okay, so we're going to start here with the upper respiratory tract. Now, when we look at the upper respiratory tract, we begin with the nares or the nostril. Okay, so the nares or the nostril, that's the opening of the respiratory cavity. And just inside of that, we see the vestibule. Okay, so the vestibule is this area right in here. We see lots of nasal hair in that area to help trap debris. And then we see the rest of the nasal passageway. Okay, so this is half of our nasal cavity. Now, the nasal cavity is divided in half by the nasal septum. The anterior third is cartilage. The posterior two-thirds is made up of the vomer and the ethmoid bone. And these ridges that we see inside here are known as the turbinates or the nasal conchae. Now, the lining that we see here in the upper respiratory tract, lining the nasal passageways, lining the paranasal sinuses, and then starting again down here in the trachea and bronchi, this lining is the pseudostratified ciliated columnar epithelium. Now, the cilia here help to move the mucus towards the pharynx. The mucus is produced by the goblet cells. Now, the mucus here in the respiratory passageways is very important. There's three primary functions of this mucus: to warm the air, moisten the air, and then cleanse the air by trapping debris, trapping bacteria, trapping viruses. Now, the mucus again is produced by the goblet cells through that pseudostratified ciliated columnar epithelium. The turbinates, or conchae, these help to increase surface area for that mucus to do its job. And when we look at the paranasal sinuses, their function again is also to produce mucus, which travels down here just below the conchae into the nasal passageways to help again warm, moisten, and cleanse the air. Now, the paranasal sinuses that we see here, we have the frontal sinus, and then we have the sphenoidal sinus. The other two sinuses are off-centered, okay, so just past this upper conchae is the ethmoid sinus, and on the other side of this one here in the face, we have the maxillary sinuses, the ones that we see taking up the cheek. Now, back here we see where the nasal passageway attaches to the pharynx. Now, the pharynx is your throat. There's three areas. We have the nasopharynx, the oropharynx, and the laryngopharynx, where these areas connect to the pharynx. Okay, so the nasal cavity connects to the pharynx, nasopharynx, oral cavity to the pharynx, oropharynx, larynx to the pharynx, laryngopharynx. Now, in the nasopharynx, we have two structures to pay attention to. This one right here, this is the pharyngeal tonsils, or the adenoids. And this hole, this kind of indentation that we see here, this is the opening to the eustachian tube. The eustachian tube helps to drain fluid from the middle ear. It also helps to equalize air pressures when you go up or down in altitude. The pharyngeal tonsil, or adenoid, okay, this is a lymph node that we see here, which is responsible for helping to initiate an immune reaction, protecting you from pathogens coming in from the eyes, the nose, or the mouth. Here we see the oropharynx, okay, the oropharynx. Now, some structures here. We see the palatine tonsil, this guy right here, this palatine tonsil. That also a lymph node initiating immune reactions. Separated nasal passageways from the oral cavity of the hard palate and the soft palate, and the tip is which we call the uvula. Okay, so the soft palate and the uvula seal off your nasal passageways when you swallow, so you don't get food and liquid up into your nasal passageways. Down here in the oral pharynx, okay, we saw the palatine tonsil, and now here in the laryngopharynx, okay, we want to pay attention to this structure right here, known as the epiglottis. Now, the epiglottis, epi means covering, right? So epiglottis covers the glottis. The glottis is the opening to the larynx. But the epiglottis covers the larynx and directs food and liquid into the esophagus, which lies posterior to the larynx and trachea. Now, here we can see the larynx, the voice box, the Adam's apple. Now, inside we can see the vocal cords. We see the false vocal cords or vestibular folds. And then down here we can see the true vocal cords or vocal fold. Now the true vocal cords have a pearly white edge because they are ligament, and this ligament vibrates when air goes past, and this is what helps us to produce sounds. Now, if we look at the larynx from an anterior view, we can see the primary cartilages here. We have the thyroid cartilage and the cricoid cartilage. Now the thyroid cartilage is more of a V-shaped with a tip known as the laryngeal prominence. Now the larynx itself, you can see, hangs below the hyoid bone. Okay, so it hangs from the hyoid bone. We can see the thyroid cartilage here, this big V-shaped cartilage, and the cricoid cartilage below it, wrapping around the bottom. Okay, so the cricoid is a circular piece of cartilage which goes all the way around the bottom of the larynx. Okay, so we can see that a little bit better here. Okay, we can see how it wraps around, and we can see it from the posterior side. Now from the posterior view, we can see some small muscles here. We have these little muscles here known as the arytenoid muscles, and they lie on top of this little piece of cartilage here known as the arytenoid cartilage. Now the arytenoid muscles are the ones that help to put tension on the vocal cords, and that helps us then to adjust the pitch or the tone of our voice. Now, the larynx is the end of the upper respiratory tract. The trachea then is the beginning of the lower respiratory tract. So we see the trachea extending from the larynx downward into the mediastinum. Just above the heart, it's going to bifurcate into the right and left primary bronchus. The point of bifurcation, this right here, is known as the carina. Now, when we look at the posterior side of the trachea, we can see the construct of the rings. Okay, so the trachea is made up of C-shaped cartilage rings. Okay, so we can see it come around, and then it's open or flat along the posterior side. Now, this flat space is there to allow room for food to go down through the esophagus, which lies posterior to the trachea. Now, when we begin to look at the bronchi, okay, so bronchi, plural, bronchus, singular, right primary bronchus, left primary bronchus, and then from there we see more bifurcations. Okay, so every time it bifurcates, we see another division. So primary bifurcates, secondary bifurcates, tertiary. All of these tertiary segments here are colored. Okay. All right, so again, right primary, and then right secondary, and then right tertiary. Now, when we look at the primary bronchi, the right side is a little bit larger than the left side in diameter. The left primary bronchus is much longer and kind of runs horizontally here. And the primary reason for that is the heart. The heart is going to sit in this area right here, 2/3 left of center. And so that left bronchus extends around the heart to get to the lung. Now, these bronchi will divide around 8 times. And then from there, we're going to see the smaller branches known as the bronchioles. Now, when we look at the bronchioles, all right, so here are the smaller structures of the lung. Okay, so this right here is a terminal bronchiole. The next branches that we see are the respiratory bronchioles. And then the smaller ones here, the smallest ones, are going to be the alveolar ducts. So we see one over here, we see one over here. And off of this alveolar duct will be a large sac of alveoli. Okay, so the alveoli, the grape-like structures in the lungs, they're grape-like structures to help increase surface area for gas exchange. So here's one alveolus, okay, or a sac of alveoli. Now, the alveoli are going to be surrounded by capillaries, and so these little red lines are the capillaries, the pulmonary capillaries surrounding the alveoli, and this is what assists with gas exchange. Now, they are fed by the arteries and veins, okay, so pulmonary arteries are the blue ones here, pulmonary veins are the red ones. The deoxygenated blood comes in through the pulmonary arteries, is oxygenated, turns red, comes back through the pulmonary veins back to the left side of the heart. Now, when we look at the lung, okay, we have around 250 million alveoli per lung. Okay, so you have a right lung, left lung. Now, the top of the lung is the apex. Okay, that actually sits above the clavicle next to the neck, or in the neck. And when you look at the right lung, again, the right lung is larger than the left lung, and that's because of the heart. Now, the right lung has 3 lobes. We have a superior, middle, and inferior. The inferior one is posterior. Okay, so it goes way along the backside of the chest cavity, the thoracic cavity. Separating the lobes, we have the fissures. This one going across the front is the horizontal fissure. The one going across the side is the oblique fissure. On the left side, we only have 2 lobes. We have a superior and inferior. Separating the two, we have an oblique fissure. Now, the one unique thing about the left lung is where the heart sits. So the heart sits 2/3 left of center. It puts a huge indent onto the left lung, and we call that the cardiac notch. Okay, so there's the cardiac notch. Now, the lungs sit on the diaphragm. Okay, so here, this muscle here that we see going all the way around, that's the diaphragm. And when we look at the area where the pulmonary arteries and veins attach to the lung, this area right here is known as the hilus, or the pulmonary hilum. Okay, so again, that's just the area here where the arteries and veins are connecting into the right or the left lung. Now, surrounding the lungs, we do see the pleura. Okay, so the pleural membrane surrounds each of the lungs. The visceral pleura is what covers the lung directly. All right, so the shiny surface of the lung is the visceral pleura. The parietal pleura is found lining the thoracic cavity. Okay, so we can see this white kind of layer here lining the rib cage. We also see it going across the diaphragm here. All right, so that is the parietal pleura. Now, between those two, we have pleural fluid, which lubricates the lung, reducing friction, but it also creates a negative pressure within that area, which keeps the lung basically stuck to the rib cage and stuck to the diaphragm. And this is very, very important because that negative pleural pressure is what allows us to expand the lungs when the diaphragm contracts. And when the rib cage expands, the lung moves with the rib cage or diaphragm. This allows us to change the volume of the lung. And according to Boyle's law, right, if we expand the lung, increasing the volume, we can actually decrease the pressure, allowing airflow into the lung and into the alveoli. Now, some other associated muscles that we might discuss would be the intercostal muscles. So in between the ribs here, we see little intercostal muscles. They help with ventilation as well. And that's probably all we need to go through with the general anatomy for today.